Welcome to the Real GI Doc Show. I'm your host, Dr. Fred Gandolfo, and I'm a board-certified gastroenterologist with a medical practice in New York. If you are just joining us today, we are going to talk about sugar. Now, Halloween's right around the corner, and I'd like to talk about what happens to people who cannot properly digest sugary candy. Now, you wouldn't think this would be a big deal, but many people with irritable bowel syndrome type complaints actually have problems digesting certain carbohydrates. And sucrose, which is table sugar, is on that list. So this is a poorly understood condition, and there's little awareness about sucrose intolerance. So today we're going to spend a little time talking about this in the context of what happens when you eat too much sugar if you're not a person that can digest sugar very well. So there's no patient case today because I just want to get into the topic at hand. With Halloween right around the corner, it's important to understand what happens when people eat lots of sugar. I want to go into how sugar is broken down by the body. Well, first of all, we'll talk about what sugar is, then how it's broken down by the body, and then we'll talk about what happens when you're not breaking the sugar down properly and absorbing it, all the havoc it will wreak in your intestine. So the Halloween candy, it's got a lot of sugar in it. We all know that. There's a whole list of, I basically looked up a whole list of candies that have lots of sugar, and right at the top, we have Nerds candy. Nerds are 93% sugar by weight, so every 100 grams of Nerds candy is about 93 grams of sugar. Pure sugar, spray painted in some fluorescent color. Delicious, the kids love it, but probably not so great for you. Now, there's other candies that have a lot of sugar in them, like candy corn, if you like that stuff, Skittles, Sour Patch Kids, Swedish Fish, basically all the stuff that looks like sugar and tastes like sugar, it's sugar. Some candies that have a little less sugar in them, but still quite a bit. Gummy bears, Butterfinger bars, Payday bars, Twizzlers, Mounds bars, all the regular chocolate bars have a fair amount of sugar in them, as you know, but a lot less than Nerds candy. Most of those weigh in around 40 to 45% sugar by weight. But the important thing is that not all this sugar is sucrose, which is table sugar. That's what you think of when you think of sugar. A lot of these candies are made with high fructose corn syrup or just dextrose, which is glucose. And they all get metabolized differently in your body. So today I want to just really talk about what happens with sucrose, which is table sugar. So what happens when you take in too much table sugar if you're not able to properly digest it? And it sounds like maybe a rare condition because most people are eating sugar all day long and fine. And it is somewhat rare depending on where you look. But it turns out that with people with irritable bowel syndrome, it's actually quite common and way more common than I knew about until I really read more about it. And way more common than you really learn about in fellowship training and all that other stuff. So it's probably what's known as a underdiagnosed condition. So it's very underappreciated and we don't often find it because we don't often test for it. There is some testing that's out there and I'd like to cover that toward the end of today's episode. So how much sugar are we supposed to get? According to the American Heart Association, about 25 grams a day for children in terms of added sugar. And for adults, they say men should consume no more than 9 teaspoons of added sugar, which is about 36 grams, and women about 6 teaspoons, which is about 25 grams also. So we really are getting in way too much added sugar just in general. They're making these recommendations more for general health, diabetes, weight, etc. But today I'll be talking just about what happens in the gastro tract for eating too much sugar. But just to put it in perspective, a Butterfinger bar contains about that much sugar. If you just eat one bar, which is a little more than 50 grams, you're going to get in about 20 plus grams of sugar or so. So who eats just one bar? You eat about 5 or 6 mini candy bars, which equal, 2 candy bars probably, and then you have a whole bunch of Twizzlers and other stuff afterwards. We're probably eating hundreds of grams of sugar around Halloween time, and the kids are probably eating 3 times that. And then the sugar sits in the house, the candy sits in the house for the rest of the week, and you nibble on that, and you go to work, and there's more candy. So there's lots of candy floating around Halloween time. So if you have no problem digesting sugar, then all you have to do is worry about your waistline and other issues. But a couple of days obviously will not kill you of eating lots of candy. It might even be enjoyable. So if you're a kid and it's Halloween time, obviously go eat the candy. It's fun. And you only live once. But if you're an adult and you're eating a bucket of candy for the next 2 weeks that your kids left behind, it's probably time to question some of those choices you're making. Now, if you cannot digest sugar, that's a whole different ballgame. You'll have all kinds of great symptoms that we're going to talk about. But what is sugar in general? It's basically energy. It's carbohydrates that are in the simpler form. So there's a couple of different types of sugars to know about. There's the monosaccharides like glucose, which is the most basic building block of sugar, where our body uses that for energy. It's, glucose is what's measured in blood glucose tests. And if you take in glucose, it gets transported across your intestinal lining and used as energy by your cells pretty easily. But then there's other sugars like table sugar, which is sucrose. So that's what you bake with, and it's also in candy bars and other things. That is a disaccharide. So a disaccharide is two sugar molecules that are stuck together by a bond. So glucose and fructose, if you stick those together, you get sucrose. So table sugar is one molecule glucose, one molecule of fructose, and is bound together with a chemical bond, and that is table sugar or sucrose. So you have to break that down. You have to break that bond between glucose and fructose, those two molecules of sugar, and you break apart sucrose, and then you could absorb the glucose and the fructose and use it as energy. Now, if you can't break the bond, then you can't absorb sucrose directly, and the sucrose ends up in your colon, travels down the GI tract, does not get absorbed. It holds on to lots of water molecules. It ends up in the colon, and the bacteria there are very happy to digest it, and they'll make gas, and you'll feel bloated, you'll get diarrhea, all kinds of great things will happen if you're not digesting sucrose properly. Now, digestion of sugars, it really starts in your mouth. As soon as you're eating the stuff, your saliva has amylase in it, which starts to break down sugar. And as the food travels into your stomach, there is further digestion from amylase, and eventually the food ends up in the small intestine. It's only partially broken down at this point. Stomach acid has done some job in terms of breaking it down. There's other enzymes in your stomach that break down the other components of food, but the carbohydrate portion gets digested by pancreatic juices into much smaller pieces. So these are pancreatic amylases and other enzymes that start to break down the food into much smaller building blocks, because your body cannot absorb a piece of pasta directly or sugar directly. It needs to be broken down into single molecules, basically. And then the digestion finishes in what's called the brush border. So the brush border is like the lining of your small intestine. So you're breaking stuff down with the enzymes into smaller and smaller pieces, and then the intestinal lining itself has enzymes that are like tethered to it that will finish the breakdown of these disaccharides. So these molecules like sucrose, when they hit the intestinal lining, you have little villi, which are little finger-like projections that stick off the lining of the intestinal cells, of the small intestinal cells, and contained there are these enzymes that are attached to the lining, and they're stuck there. They're not secreted into the gut, they're actually tethered to the lining. And when they come across sugar, like sucrose, they finish the breakdown into glucose and fructose, and then those glucose and fructose molecules can get absorbed into your small intestine and used as energy by your cells. So if you're not able to produce that enzyme, or you're deficient in those brush border enzymes in your small intestine, you can break down the sugar into smaller and smaller pieces, but you can't actually break it down into monosaccharides and absorb it. What happens is it just passes through unabsorbed, and it ends up in your large intestine or further down your small intestine, and now it just is food for bacteria. And bacteria are really great at digesting everything, so you can bet that your bacteria will be happy to get a sucrose meal, and they'll make lots of gas and hold on to extra fluid and water, and you'll get all kinds of other ugly symptoms like bloating, abdominal pain, diarrhea, and did I say gas? I said gas. You get a lot of gas with this. So if you're not absorbing sugar, it makes its way down to your colon, feeds the bacteria, you get gas, bloating, and other IBS-like symptoms. So when do you think of a sucrose intolerance? Well, you think of it when people have irritable bowel-like symptoms. So irritable bowel syndrome, or IBS, is a super common thing. It's about 10% of the US population has some form of irritable bowel, and we see it all day long in the office, and a lot of people, we just don't know how to handle it properly because we try all kinds of different things. We try to exclude a whole bunch of other issues. We try a whole bunch of different medications or dietary strategies, and some people just do not get better, and we wonder why that is. And some of that is complicated, and there may be other factors playing a role here, but some of these people probably have a carbohydrate intolerance, like a sucrose intolerance, and we're just not picking it up because we're not testing for it. So if you think of people with IBS, and if they don't respond to the typical dietary interventions, nowadays that's called a low FODMAP, FODMAP diet. So if people don't respond to that kind of dietary intervention, and you've ruled out other causes of irritable bowel syndrome, then think about possibly having sucrose intolerance, especially if the symptoms come after a meal, and if there's some diarrhea component to these symptoms. So if you eat something, you get bloated, you get diarrhea, sometimes pain, lots of flatulence and gas, think about sucrose intolerance. And this comes in a few different varieties. So traditionally, when I was doing training, we never really even spoke about sucrose intolerance. I feel like we covered it probably in, a side note of a chapter somewhere on carbohydrate digestion, and it was thought of as a pediatric type illness. So it's a congenital, the strict definition of this condition is really more of a congenital problem, meaning you're born with an enzyme deficiency. The condition is called congenital sucrase isomaltase deficiency, and it's estimated to be only in about 0.2% of people. Typically, it's diagnosed in children, and in terms of adult GI, we rarely think to test people for a congenital problem that they've had since childhood. But if no one's looked for it, then it could still be there. And with only 0.2% of the population having this, it's still not completely uncommon. It's just not the most common thing that you see. And again, it really flies under the radar for adult GI. It's rare that people test for this kind of thing, including myself. Until I really saw a few people with it and started to read more and more about it as I practiced, it was not a thing that was high on my radar either. So still worth mentioning for sure. But what's a little more exciting, I guess, in the field is that there is a whole subset of people who have functional deficiencies in the enzyme that you need to digest sucrose, which is called sucrase or sucrase isomaltase. But a lot of people are deficient in that enzyme, not because they're not born with it, but because they somehow don't have it functioning, or they've lost the enzyme, or some other issue is going on that's disrupting their enzyme activity in their brush border of their small intestine. And there's a whole bunch of things that can do this. And they're often things that we rule out anyway when we're working someone up for irritable bowel syndrome. If we're doing a really good job, we're ruling out a whole bunch of stuff in that irritable bowel syndrome mimic category. These are conditions like Crohn's disease, celiac disease, SIBO or small intestinal bacterial overgrowth. You also suspect it in people who have autoimmune conditions, so autoimmune diseases causing enteropathy or inflammation in the small intestine, people who've gotten chemotherapy or radiation somewhat recently, people who have certain infections, especially people who've had bacterial enteritis and have a post-infectious gastroenteropathy, they call it. So this is when people get a bad infection, vomiting, diarrhea, fever, all that stuff. It gets better, but they have these long-lasting irritable bowel type issues. It's also called post-infectious IBS. So this kind of thing can damage the brush border of the small intestine, hopefully temporarily, and can also cause enzyme deficiencies like sucrase isomaltase deficiency. And there's other things like medications, NSAIDs, etc., that can cause problems. So the bottom line is that you could either have the classic congenital version of this, which is more rare and only affects less than 1% of the population. But in adults, we should also be on the lookout for the more acquired type of sucrose intolerance, which you can see for all these other secondary reasons. And it's important because if you can identify it, there is treatment available for it. So how do we test for sucrose intolerance or sucrase deficiency? Well, there's a few different ways to do it. The easiest and most non-invasive way to do it is with a breath test. There's breath testing that you can do either by giving someone sucrose and measuring hydrogen levels, or the more specific breath test, which is a commercially available test that can be used to measure carbon-13 sucrase activity. So you give someone sucrose that's labeled with carbon-13 and also take breath samples and determine if the carbon-13 is being absorbed by their body or not that way. So that's a little better than the regular old sucrose breath test that you can do. There's a genetic test that you can do also if you're looking to see if someone has the genetic variant of congenital sucrase isomaltase deficiency. But then the gold standard test is actually a small intestinal biopsy. So on an upper endoscopy, which you do often for irritable bowel type issues that come with bloating, or for many other reasons, you can biopsy the small intestine and send a specimen out to a specialty lab, and they can measure enzyme activity directly from the specimen. And that's considered the gold standard. It's not done routinely with most endoscopies because it is a challenging thing to handle the specimens. They need to be frozen and sent to the lab right away. Otherwise, the enzyme activity will not be measurable. But if you're looking for it specifically, it can be arranged to do a small intestinal biopsy during an endoscopy to really see if someone is intolerant to sucrose and to check their enzyme activity. So is this like a fringe thing, or is this like a common problem that we have to look for? Well, this is the surprise here. So when I read about this stuff, it is interesting because if irritable bowel syndrome affects about 10% of the population, a substantial portion of people have some type of carbohydrate intolerance. And when it comes to sucrose intolerance, a lot of people in the category of irritable bowel syndrome have some type of a disaccharidase deficiency, so they can't digest certain carbohydrates. So talking about sucrase isomaltase deficiency, In one study, even though this is a small study, they said about 35% of patients who had common IBS symptoms had a deficiency in sucrase isomaltase demonstrated on testing. That's a huge proportion of people who have IBS. So you take 35% of people who have IBS-like symptoms, they're going to be intolerant to sucrose. That's remarkable. Now, these studies are small, and I'm sure they're flawed, but it's an interesting concept. In a slightly larger study, but still quite small, 82 patients with IBS diarrhea type issues or IBS with mixed diarrhea and constipation. Lots of people had disaccharidase deficiencies. There were 50% in this study had sucrase deficiencies, so they could not digest sucrose very well. That's a lot of people. I mean, if we can identify these people and treat them, that's a lot of people who would not have the IBS symptoms, or maybe would be improved with respect to their IBS. So how do you treat someone? If you do one of these tests, like a breath test, or you do a biopsy test, and you find that they're sucrose intolerant, well, the key thing is you try to avoid the offending agent. So you try to avoid sugar as much as you can. So you eat more of a whole food diet. You watch out for sugars. You try to work with a dietitian and figure out a good meal strategy to avoid as much sucrose as possible. But there's also a role for looking for these other conditions. So you make sure that you have definitively ruled out SIBO, small intestinal bacterial overgrowth, Crohn's disease, celiac disease. You've taken a thorough medication history. You've looked for autoimmune conditions, etc., and so forth. So you want to make sure there's no underlying cause of this enzyme deficiency. And the third thing you can do, or the fourth thing you can do, depending on how many of these things you're counting that I'm saying, is enzyme replacement. So there are commercially available prescription enzymes. The trade name of this is Sucrade, Sucraid. But there's commercially available enzymes that you can take with a meal to help you digest sucrose in the meal. And people who take this do report improvement in the symptoms of IBS, because if you're digesting the sugar, it's being absorbed by your small intestine, it's not making its way down to your colon, and therefore it's not causing the bloating, gas, and other issues that go along with that. So in conclusion, this topic was a little eye-opening to myself because it forced me to do a little reading. After seeing a few patients coming in with this recently, it forced me to do a little reading and realizing we're probably under-testing people for this condition. That people with IBS and diarrhea and bloating and lots of gas, which is super duper common, tons of people every day that you see with these conditions, testing these people for these disaccharidase deficiencies is probably a worthwhile endeavor, especially if they haven't responded to the typical stuff, which is some diet modification, namely a low FODMAP diet, maybe a trial of medications, maybe looking for other conditions. But if all those things have been tried and nothing really helped, it's probably worthwhile to check for these disaccharidase deficiencies. The other thing to mention is that we probably all eat too much sugar, so it's great around Halloween time, but don't make it an everyday affair. And if you have issues after eating lots of sugar that look like irritable bowel syndrome, think about talking to your doctor about testing for sucrase deficiency or sucrose intolerance, or however you want to say it. It could be a valuable thing to know about, and there is treatment out there. All right, thank you for listening to this episode. Hopefully this was enjoyable and you got some useful information out of this. I know I sure did, because it forced me to read a little bit about sucrose intolerance, a topic that does not get a lot of coverage nowadays. Until now, that is. So enjoy the Halloween time candies and festivities, and then a few days after Halloween, bring all that candy into work and make sure your coworkers eat it and get it out of your house. That's the secret. And if you're having issues digesting sucrose, now you know what to do. If you like this episode, give us a follow on social media at RealGIDoc, or leave a comment somewhere. Maybe go on Apple and leave a nice comment or rate the show so other people find it. Hopefully this was not too spooky. I wanted to do a spooky Halloween episode, but there's really no spooky GI topics that I could think of that are, appropriate for mass consumption. There's definitely some spooky GI topics out there, but mainly weird stuff that I don't really want to go into on the show that you see when you work in like a public hospital. Let's not go there. Maybe one day. Anyway, thank you for listening, and I'll talk to you next week about more interesting GI topics.
That's it for this episode of The Real GI Doc Show. Make sure to join Dr. Gandolfo next time to explore another interesting topic in gastrointestinal health. And remember, the views and opinions presented in today's episode are for informational and entertainment purposes only. Nothing discussed in this episode should be considered or used as a substitute for medical advice, diagnosis, or treatment. If you're experiencing a health issue, please consult with a doctor or a medical provider in your area. Thanks again for listening to the show.